Good morning, doctor. So this is the student project presentation from small group discussion D7 with our title, Problem Based on Antibiotics Prescribing. These are the member of small group discussion D7, and this is our table of content from this presentation. Now, please let us start the presentation, starting with the chapter 1, Introduction. First, let me introduce myself. My name is Afilanita Agustin with the last 3 digits 150. I will explain about the background information of this student project. So, antibiotics are defined as a type of drug used to prevent and treat bacterial infection, which always regulated by the provisions of drug prescriptions. So, it does not trigger any medication error. One of the medication error that are often heard is in the prescribing error phase. Prescribing error is a form of error in the writing of drug prescriptions that can lead to the misuse of drugs. The use of antibiotics that are quite common. Therefore, the prescribing phase must be watched out for in every prescription writing. This has become our concern and background in compiling a student project with the theme Problem Based on Antibiotics Prescribing. We hope that this student project will be able to make readers understand and be aware of problems that are often encountered and related to antibiotics prescribing. That is all from me. Next will be explained by my friend.
Okay, let me introduce myself. My name is Brain Chandra with the last 3 digit 152, and I'm going to explain the next part. For the first one is the problem foundation. What is the definition and function of antibiotics? What are the methods of prescribing antibiotics? And what are the problems based on antibiotics prescribing? For the next part, objectives. It's first to understand the definition and function of antibiotics. Second is to understand the methods of prescribing antibiotics. And the last one is to understand the problems based on antibiotics prescribing. And for the last part, it's the benefits for the writers and the readers. For the writers is to increase and deepen the author's knowledge of problems based on antibiotics prescribing. Moreover, by working on this student project, the writers also gain abilities in searching for literature and an increase in critical thinking abilities. And for the readers is to expand and deepen the knowledge related to problems based on antibiotics prescribing. And moreover, the readers are expected to gain knowledge about the definition and function of antibiotics.
I'm Anastasia Andriatan Berius, and my last 3 digit numbers are 154. Here, I'm going to explain about the definition of antibiotics. The term antibiotic comes from Greek words. Anti means against, and bios means life. Antibiotics are molecules with low molecular weight, with average weight of less than 1,000 Daltons, that are particularly against the life of bacteria. Hence, antibiotic can be defined as medicine that slows down the growth or destroys bacterial infection. The most well-known antibiotic is called penicillin, which comes from the Penicillium fungi.
Before I continue, let me introduce myself. My name is Mandi Dantawiarta, with my last 3 digit number being 147. And now I will explain about the functions of antibiotics. Antibiotics are mainly used to prevent bacterial infections within or on the body and are usually not effective in treating infections other than bacteria, such as viruses and fungi. By directly targeting the bacteria, it can prevent the bacteria from reproducing, or it can kill the bacteria itself. Because many infections are caused by viruses, nowadays antibiotics are rarely used to treat trivial infections. However, antibiotics prophylaxis is still a common thing to be used to prevent bacterial infections, such as several surgery procedures needs the antibiotic prophylaxis in order to avoid the risk of infections. Other than that, people that are vulnerable to the effects of infection are recommended to take antibiotics, such as people aged over 75 years old or people with weakened immune systems. Okay, that's all for me. Next slide.
Okay, first, let me introduce myself. My name is Febrano Di Prawira with the last 3 digits number of 156. Now I'm going to explain about the methods of prescribing antibiotics. Before prescribing antibiotics, physicians should confirm the presence of a bacterial infection. Confirming this can be done by doing a diagnostic test. A diagnostic test includes 2 steps. The first one is a complete medical examination. A complete medical examination involves history taking and examination of the patient. This is done to rule out diseases. The second step is to do a bedside test or a laboratory test. A bedside test is the act of performing a laboratory test near the patient. Examples of this is the urine dipstick test. Laboratory test, on the other hand, is more accurate, but the results takes a lot more time to get. Examples of laboratory tests are bacterial culture and serology. After diagnosing the patient, physician should inform the patient and prescribe antibiotics if the results are positive. There are a few factors that can influence antibiotics prescribing. First one is the clinical situation of the patient. An unclear clinical situation can cause uncertainty. Uncertainty can either promote or hinder antibiotics prescribing. Second one is advanced care plans. Antibiotic prescribing should not be done when the care goal is for comfort rather than life prolongation. The third one is diagnostic resources. Limited diagnostic resources contributes to clinical uncertainty, which can either promote or hinder antibiotics prescribing.
My name is Stella Angelin Ispianto, and my last three digits are 142, and now I will continue about the factors that affect antibiotic prescribing decision. Okay, so next is physician's perceived risk. So with regard to perceived risk of treatment, some physicians describe situations in which the risk of side effect was mentioned as one of the reasons to not prescribe antibiotics, whereas perceived risk of non-treatment appear to influence the antibiotic prescribing decision, especially when physicians experience uncertainty. Okay, so the next one is influence of others. It can be from colleagues, the patient's family, and nursing staff. So physicians will be more easily influenced because of the poor information about the clinical situation of a patient. The poorer the quality of the information, the more difficult it can be to assess the clinical situation and make a right treatment decision. And the last one is the influence of the environment. So this includes the availability of evidence with regard to treatment of infections. It is reported that treatment decisions are complicated by a lack of prescribing guidelines for the older population, a lack of insight into local resistant patterns, and the limited accessibility of information in medical files can complicate antibiotic prescribing decision-making.
Next presentation will be presented by Minil Putuma Putri Kalika with last digit number 155. Problem base of antibiotics prescribing. Antibiotics are often overprescribed to outpatient, and the availability of over-the-counter antibiotics in many developing countries, and that severely limits therapeutic options for the treatment of life-threatening infection. The data shows that the Center for Disease Control and Prevention in the USA states that there are 50 million unneeded prescribing of antibiotics out of 150 million prescriptions every year. And it causes a lot of problems. One of them is antibiotic resistance. So what is antibiotic resistance? Antibiotic resistance is the ability of bacteria to neutralize and weaken the work of antibiotics so that the bacteria become resistant to the antibiotics and can no longer be killed. Antibiotic resistance causes a lot of impact. Two of them, such as the high social burden. The existence of resistance to antibiotics causes a high social burden due to high mortality, cost, and the incidence of illness. The other impact is high cost. The cost of patient care is increasing because it requires more cost for second-line treatment, longer hospital stay, high diagnosis cost, and increased incidence of complication and cost for prevention. So that is for me. Thank you.
Hello, my name is Imadian Jadi Kabanas Jawa with last three digit numbers 148. So I will explain about the several resistant mechanism of antibiotic that occur. First is microorganism produce enzyme and destroy the active drug. The second is microorganism change their permeability to drugs. For example, tetracycline accumulate in susceptible bacteria but not in resistant bacteria. The third is the microorganism changes the target structure for the drug. For example, chromosomal resistance to aminoglycoside is associated with a specific protein change in the fatty acid unit of the bacterial ribosome, which act as a binding site in susceptible organism. The fourth is microorganism develop new metabolic pathways that dictate pathways normally inhibited by the drugs. And the last is microorganisms develop new enzymes that can still perform their metabolic function, but are slightly affected by drugs. For example, in trimethoprim-resistant bacteria, the hydrofolate reductase enzyme was inhibited less efficiently than trimethoprim-sensitive bacteria. Thank you.
My name is Gusting Ragung Radya with my last 3-digit number is 144. I'll explain about adverse drug reaction. An adverse drug reaction is any adverse reaction to drug beyond its intended therapeutic effect occur during clinical use. Adverse reaction can occur with any class of drugs. The most troublesome classes of drugs that contribute to adverse drug reactions are antibiotics, followed by anti-tumor drugs. Antibiotics have been reported to be the leading cause of ADR. Studies involving only outpatients reported sulfonamides as the most common causative antibiotic, followed by penicillin. Previous reports have shown that quinolones, especially ciprofloxacin, are another common causative antibiotic. This study shows that penicillins and quinolones are involved in the majority of ADR. Adverse drug reactions remain a major health problem worldwide. They affect patient outcomes, increase hospitalization, increase morbidity and mortality, increase treatment costs, impair quality of life, and affect patient satisfaction with healthcare. Thank you.
Hello everyone, my name is Grace Valerie with the last 3-digit number of 143, and in this presentation I'm going to present about solutions for problem-based antibiotics prescriptions, especially antibiotic resistance. So the first solution is by the combination therapy with existing antibiotics. For example, class of beta-lactamase inhibitors expands the broad spectrum of antibiotics. Second solution is by amphiphadic molecules that target bacterial membranes through both hydrophilic substituents. This will cause interaction of negative charges in the surface of the membrane and hydrophobic substituents that will disrupt the lipid chains of bacterial membranes. Third solution is by a polypharmacy approach on bacteria by providing the entrance of the antibiotics to the cell and the energizing efflux pumps that the bacteria use to escape antibiotic action. Last but not least is the identification of molecules that inhibit sulfur metabolism that will eventually cause the decreased bacterial fitness at infected site. That's all from me. Thank you.
My name is Happy Sumamulia with the last 3 digits of student ID number is 151. Here I would like to present the solution for problem-based antibiotic prescriptions, especially for adverse drug reactions. So the first one, we can prevent the IDRs by 2 approaches. There are provider-based approach. We can careful and choose the antibiotic with higher risk, withdraw unnecessary drugs, examine if the antibiotic can lead to new symptoms, keep away from the possibility of concomitant drugs, adjust the dose based on creatinine clearance and age of the patients, and ensure there is no adherence effect. The second approach is system approach. There are utilize computer and digital assistant, use electronic medical record, involve pharmacists, and utilize the built-in safety features. And then while the prevent, we can treat the ADRs that this solution aims to plan and mitigate if the ADR is occurred. For example, the doctor prescribed folic acid as adjuvant to the methotrexate in order to reduce the folic deficiency, or the doctor monitor the patients with renal deficiency who given amphotericin B.
Allow me to introduce myself. My name is Carla Kinovlin Manulang with my last 3-digit number are 146. Now I'm going to give a conclusion from our presentation. Antibiotics are molecules with low molecular weight, with average weight of less than 1,000 daltons, that slows down the growth or destroys bacterial infection. Antibiotics are mainly used to prevent bacterial infection within or on the body and are usually not effective in treating infection other than bacteria. Antibiotic treatment may be included in the advanced care plan, thereby anticipating situations in which antibiotic treatment potentially prolongs life. Physicians should not prescribe antibiotics when the overall care goal in the advanced care plan was defined as comfort rather than life prolongation. Antibiotics are drugs that are most widely used irrationally, namely excessive uses, such as use for unclear indication, use in inadequate doses, route of administration, time, and duration of antibiotic administration are inadequate. Irrational use of antibiotics can have various negative impacts, including the emergence of unnecessary side effects or toxicity, accelerate the occurrence of resistance, spread of infection with resistant bacteria, the risk of therapy failure occurs, increases the severity of the patient's illness, and increase the length of time the patient suffers, as well as increase the cost of treatment. That's all from us. Thank you for your attention and have a great day.